Narcolepsy has been described since 1957 as a sleeping disorder involving excessive daytime sleepiness, cataplexy, hypersomnia, and sleep paralysis as its primary symptoms. Today, these descriptions remain. Narcolepsy consists of irresistible, sudden, daytime sleep attacks that may be 5 to 30 minutes in length. Patients describe narcolepsy as a perpetual sleepiness, a state where one is not fully awake nor fully asleep. Narcolepsy is not rare, but it is one of the most unrecognized and underdiagnosed disorders. Narcolepsy occurs in 5 out of every 10,000 people. Typically, narcolepsy begins to appear in people in their teens or early 20s, although onsets in younger and older people may occur. People with narcolepsy may also experience hallucinations. Hallucinations tend to occur at the beginning or end of sleep. These hallucinations are vivid, brief, dream-like occurrences. They may be visual, auditory, tactile, or involve movement. They may leave a person with a sense of fear and may be overall dangerous for a person. Furthermore, about 1/3 of people suffering from narcolepsy report experiencing automatic behavior or blackouts. People with automatic behavior continue behavior they may be doing in their awake state without any recollection of it. These episodes can last minutes or even hours. Another symptom commonly felt is sleep paralysis, which is the inability to move upon awakening or when attempting to fall asleep. Although studies have shown that there is no indicative symptoms and biological markers for this disease, cataplexy is a definite exception. 60 to 90% of people experiencing narcolepsy experience cataplexy. That means that only about 10 to 50% have narcolepsy without cataplexy. Cataplexy can range anywhere from weakness in the limbs, face, or speech muscles to total wilting collapse. Moreover, cataplexy is often triggered by emotions. In fact, a study confirmed that joy and happiness triggered cataplexy the most, over surprise and anger. Moreover, it usually doesn't take much time for people with narcolepsy to fall asleep, and they usually experience a poor night's sleep, with frequent arousals and awakenings contributing to excessive sleepiness. When they wake up, they feel unrefreshed and it takes a long time to get going in the morning. What causes narcolepsy? There's no definite answer as to the cause of narcolepsy, but there is evidence prompting genetic factors. Narcolepsy may also be caused by damage to the brain or from other medical conditions. People with narcolepsy plus cataplexy typically have reduced levels of orexin, a neurotransmitter that regulates arousal, wakefulness, and appetite, resulting in irregularity in sleep behavior. Another commonly proposed explanation for narcolepsy is that it is caused by an abnormality in REM sleep initiating mechanisms. REM is a phase in our sleep cycles that inhibits muscle movement but shows high brain activity. During this phase is when we have vivid dreams without acting them out. Hence, cataplexy and vivid hallucinations, as well as sleep paralysis, may be explained by inappropriate triggering of REM sleep during the daytime. These symptoms affect their daily lives. Many suffer from a number of accidents caused by their cataplexy and may get fired from sleeping on the job, and cannot enjoy overly emotional activities such as watching sports game, laughing, dinner parties, etc., and fear that their cataleptic attacks might get triggered. Thus, this damages their social skills and emotional connections. As a result of this, they often are somewhat depressed, anxious, and frustrated, and they are sometimes perceived as being unmotivated, withdrawn, and aggressive. However, there is treatment. Treatment includes improvement of sleep with good sleep hygiene and sleeping pills, control of wake time symptoms with scheduled naps and drugs, such as stimulants for the sleepiness and other drugs for the cataplexy, and avoiding potentially dangerous activities. Also important are psychological support and family therapy.